All right, I'm going to call the Mental Health Board meeting for April 22nd to order. Can I get roll call?
Christina Brune.
Here.
Adam Carson. Linda Hoke.
Here.
Deanna Kell.
Here.
Thomas Langhenry. Amy Rath.
Here.
John Reinert. Carolyn Schofield.
Here.
James Swarthout.
Here.
And can I get a motion for Jimmy to participate via phone due to work reasons?
So moved. Seconded.
All those in favor say aye. Aye. Any opposed? All right, you are now officially participating. So is there any, and John Reinert is here, so I'll add him to the roll call. Public comment. I don't know if there's, yep, please, thank you. Yep, if you press that button and then I'll turn it on here. The one with the little person on it. Yep, there you go. There you go, you're all good.
Okay. Hello, my name is Courtney Behrens. I'm the program manager for Neuroinclusive Counseling, referred to as NIC. We are the newest program within Options and Advocacy, just right across the parking lot.
It is on.
We started the program in July of 2023 with the help of ARPA funds. Our agency had to start the program from the ground up, finding space, hiring staff, providing additional specialized training, and obtaining everything, even from the name of the program to an EHR system. We began seeing clients in the fall of 2023 and hit the ground running in 2024 with just 2 offices rotating people in and out. We now operate out of 8 offices, one of which is a sensory room, a favorite space for many of our clients. Our program has always believed in the power of using interns and utilized our connections with the local universities to develop a strong neuro-affirming team. Often over the past few years, we have been able to hire those interns as therapists. In fact, NIC has had the same staff, and we're adding more since its creation. Our team prides itself on a strong professional clinical background while creating a safe space for our clients. Unfortunately, many of our clients have been declined from services from traditional therapy due to diagnosis. Our journey through this grant has been very rewarding. However, it has not come without significant challenges, albeit even strife. We paneled with major commercial insurance companies early on to be able to accept most plans. However, we know that most of our clients, 75 to 80%, have Medicaid. Many of our families are living on the brink of financial insecurity daily. We began the process of becoming a BHC this time last year. We completed all the requirements early fall. Unfortunately, Medicaid is a difficult system, even when you follow the steps and do it right. We've had significant delays which have impacted our program. Thankfully, we are now billing Medicaid, although the return is extremely slow. We serve many families that are uninsured or cannot access insurance benefits for a variety of reasons. We are committed as a nonprofit to support our community and offer sliding scale to those that cannot access services elsewhere. This leaves us with the ongoing need for grant funding to assist those in our community. We have built a very successful and impactful program. Very few clients have ended services with us since 2023. We know that therapy is a long game. It's not a short option. Our no-call, no-show cancellation rate is extremely low, and in fact, at times we've had wait lists, and we continue to receive steady rate of referrals from some of our local partners. We wanted to invite you to visit the Neuroinclusive Counseling Program over at Options and Advocacy. I know Winter passed out some information about our program, if anyone would ever want to come and visit us. Thank you.
Thank you. Anyone else? Winter?
I'm much shorter than Courtney. And I know we're only supposed to do 1 per agency, I think, is the new rule, but oh, good. Then I'm not breaking a rule. Well, first I wanted to start off by just thanking you guys for all your dedication and time that you're giving to our mental health board. It is a huge job to step into, and it was a real pleasure. Darby and I went back and forth as she was listening from home, and I had the opportunity to be here in person yesterday and listen. I did join by video after after I stepped out, but great discussions, and I'm looking forward to see what happens tonight, too. So on to what I need to say. I want to continue what Courtney was sharing. She kind of is introducing that this NIC program, Neuro-Inclusive Counseling, has been piloted now based on those ARPA funds for startup. NIC was developed because of an observable need in our community. For years, we've discussed how individuals with autism and other diagnoses would struggle to access services. And so when the opportunity became available, we really knew we had to go after it and try to create something important for our community. Those Medicaid delays really had made an impact on our funding. And so we were moving through those ARPA funds much faster than anticipated. And so we, at that time, when we realized we were going to be facing a fiscal issue, reached out to the mental health board and met with your staff, actually, and we had some really honest and important conversations that I valued as well and thank them for. We were able to get into gear with our board and our other leadership at our organization. Courtney and I spent countless hours applying for more grants, utilizing the mental health board grant writer as well, tapping into other grant writers, our community partners. We were able to actually ask for more ARPA funds from county, and those were awarded to us. So those were going to be ARPA dollars that were going to go underutilized, right? Just like you guys do. And I was like, hey, maybe we should just ask. And it worked, and it was great. And so we were awarded a nice $97,000 additional award from ARPA funds, which is amazing. Northwestern gave us a grant. Foglia Foundation offered us some additional dollars, as did our Community Foundation for McHenry County. So I'm very excited to tell you guys that we are in a very strong position right now. And we're good until like fall, winter time of 2026, if you know where I'm going with this. And so we do plan to apply, to the mental health board during the regular allocation cycle, and just look forward to sharing more with you over these next couple of months about the program, why it's important to our community to sustain it and maintain it. And it really does. It's going to always need some grant funds behind it, but you're not the only people we're looking to for it as well. So thank you for your time.
Thanks. Can I just ask you a question before you
Yes,
sit down?
absolutely.
And I apologize if you said it. I was kind of writing some of your notes while I was thinking. Did you use our grant writer on those, or were we able to help you with those grants?
We love Kelly. We would like to own her if that's at all possible. But we share her with the rest of the county, right? Those who need her. No, we do. She's fantastic. She has allowed us to apply to, gosh, off the top of my head, I want to say at least 10 grants since we've been working with her, and some of those haven't come to be announced as to whether or not we're going to be awarded. But I do believe she helped us with that Northwestern application, which we got. So that was awesome. And we continue to work. She's working on like 3 of them for us right now. And then we do have access to additional grant writer right now that our board invested in for us too. So, so we're very lucky to have all of that in our pocket at the moment. But
Great.
yeah.
Great. Thank you so much.
Yep.
Great. We can all work together. Thanks. Anyone else public comment? Feel free.
Twist my arm.
Yes.
Hi, everyone. Hello, board. I'm Alex Matheson. I don't know a handful of you. I knew the older board, so I wanted to come in and say hello. I'm the program director at Live for Lowly. Wanted to say thank you all for your continued support since December of 2017. That's been huge. I've been a resident in this county since August of 2017, and I want to say I love what you all are doing, and of all the other mental health boards that I have to interact with on a regular basis, you guys are my favorite, but don't tell them. And I know this is public knowledge and public comment, but hopefully they're not listening. Sorry, Oak Park. But I wanted to give a little bit of programmatic updates to some of the stuff that we got going on in your county right now. So last month we engaged with 650 people, with 576 of those being youth students in the high schools here in the state. Through our SMART meetings last month, we had 208 people attend. I'm very, very happy with those numbers as a person in recovery and as somebody that watched those programs kind of form. It's a testament to the talent that we were able to bring from this county here to serve the people here. So again, I just wanted to go up and say hello, introduce myself to those of you that I don't know, and to say thank you for your continued support for a decade. I'm going to say a decade. We're going to go for a decade. So thank you. And I look forward to working with all of you.
Great. Thanks. Anyone else? No? All right, then we'll close the public comment portion. And I will look for an approval of the minutes from March 19th, 2026 Committee of the Whole. And if you want to do them together, you could do it with the March 24th, 2026 regular board meeting. Is there a motion?
I'll make a motion to approve the minutes of the March 19th Committee of the Whole meeting as well as the March 24th regular board meeting.
Is there a second? Okay, motion and a second. Any discussion? Oh, should we go or can I do it minutes? Yeah, okay. All in favor, say aye. Aye.
Aye.
Any opposed? All right, that motion passes. Presentation. We don't have any right now. I will move on to reports. So on the President's report, I just wanted to remind everybody that May 7th from 5 to 7 p.m. is our town hall, so invite everyone to attend. I would like to note that the McHenry County Department of Transportation will be here, and they will be helping people navigate through the process of which they can sign up for their the reduced program, but also for their Connect program. And they'll do a little talk at the beginning about the programs that they have in the transportation space. So anyone that's interested in that or needs assistance in helping to navigate through that system, please come. They will be here and providing information and that assistance. And if you are not able to attend, board members, could you please let Bridget know, because there are a couple that can't attend. So we want to make sure we will have a quorum for that, because it is an official meeting as well. Anything else on the town hall? Okay. And then the second piece of it is the mental health board officer elections, which will be in June. I know we were kind of off because of the switch, so we'll be electing the president, vice president, secretary, and finance at that June meeting. I've been kind of trying to think if there's, and I actually will open it up right now. If anyone has any thoughts or suggestions on how you might like this to go, because I've struggled with the ways in the past, because I want people to have the opportunity to participate if they want to run for something, or, but I know people typically don't, because, you know, you just don't ever want to make waves. But I want people to also like interject themselves into the board more if they want to. So I will open up suggestions. I mean, how I'm used to doing it is usually the newest board members kind of form sort of a nominating committee. We can do 2 people on this board before we would come into quorum issues. And then they would kind of contact the other board members, see their level of interest, if either they wanted to stay on their current position, if anyone was interested in those positions. And then they would try to then bring forth who would be interested and nominate a group. So I'm open to suggestions of what you guys think. I just don't want to come up here and say, this is who it's going to be. Does anybody want to challenge it? I don't want to do that, which I just think I would like to be more open in participation. Anyone have any thoughts? Don't force me to do that, because I'll find a different way either way. But I mean, I don't know. Are you open to the like having, you know, a couple people step up and have those conversations? Oh, sorry, Amy. Thank you.
That's fine. I mean, however we want to do it is, I'm supportive. Has the lack of participation been the reason? Because I think previously we just emailed, maybe. Like, I don't know how it happened the first couple of years I was here. But do we feel like if folks didn't just email Bridget with their interests, like we just wouldn't get anyone? Or I don't want to over-engineer, but I also want to make sure everybody feels like they have an opportunity to participate, exactly like you were saying, and that no one feels intimidated. So we'd just love to hear a little bit more about
Well,
Your thoughts?
yeah, and why I was conflicted is actually because I've had conflicting information, and it came from a couple years. Like, so there was, when we do our board review, our self-review, it did come out that nobody knew Steps Up. But at the same time, nobody knew was given the chance to really step up, I felt like. So it's like, and the same people would volunteer, so does nobody new step up? Or is the process not allowing for anybody to step up? I'm not sure which it was. That's why I'm putting it out there. If people feel like, because I always felt like, well, I would step up, but I didn't want to but they're Phil. I wasn't going to challenge people either. They were doing a fine job. So at the same time, a way for people to have discussions. So I don't know. Since Tom, I really did kind of suggest that you and Deanna be on a new committee, and that would do this nominating committee. I don't know if you want your thoughts, if you want to step in. I thought it would give you guys an opportunity to talk to all the board members at the same time, but I don't know how other members feel. I mean, I'm fine doing it the same way if that's what everybody wants, or if you guys want to have those conversations, I'm fine with developing a new nominating committee.
I'm fine with the nominating committee. I think that'll give us a great chance to connect with everybody a little bit more too and learn from them as well, being a new board member.
Great, thank you. That's what I was kind of thinking. Are you good with that, Tom? Okay. And I can just create that, right? Yeah, okay. So I will do that. And then, so this is until June that we need to bring forward, so we can have those conversations between now and that time. You can have those conversations. We can talk offline too on what that will look like. So, but thank you all for your input. Anyone else have any other suggestions or thoughts? Or else, I think it's a good way for everyone to kind of connect and talk to each other. So, cool. All right, so that's all I had on that. So in May, or in June, the nominations will come forward and we'll vote on it. Next is operational report. Bridget.
Okay, I don't have a lot to add with everything going on. If you have any questions, I'm happy to answer them. I did want to say something about the town hall, but Carolyn already has mentioned that. I do want to say that our 12-page insert has been pushed out to 29,000 people today. So we should start seeing a lot of that, not only in paper, but via email. So hopefully we'll see a lot of good feedback on that. So other than that, I really don't have anything else to add.
Great, and thank you for all that work. That looked really nice.
Yeah.
So thank you for that work.
Absolutely. Do either of you have anything to add? Okay.
All right, ethics and compliance.
Amanda wants to say something.
Oh, I'm sorry, you do? I'm sorry, Amanda.
That's okay. I just wanted to actually thank you, Carolyn, for connecting me with someone from Medicaid. QMT has asked for Medicaid training, especially when it comes to these redeterminations, and the rules are changing. And so I had a real challenge connecting with anyone in that office, and Carolyn graciously helped me with that. So I just want to thank you for that.
Yes, thank you. Sometimes it helps to have secret numbers. So, I'm glad, and hopefully that all goes well. And thank you. Ethics and compliance. Anything more on that? Only if you want to. We don't need to because we all went through it yesterday. So, great. Well, thank you. Finance and audit. Anything more on that one? Or you want to report anything? Okay. Anyone have anything from yesterday? All right, we are good. So I will now entertain a motion for the consent agenda. And if you want to make the motion and repeat the items, if you're going to include all of them, that would be great. Whoever wants to make that motion. Anyone? Amy, I will turn, thank you, Amy.
Sure. I will make a motion to move into the consent agenda, items 6A through 6C. Do you want me to read them individually?
Yeah, if you could.
Sure. So items 6A, the finance reports for the period ending March 31st of 2026. The 6B, the opioid fund reports for the period also ending March 31st, 2026. And 6C, the mental health board bills for March 2026.
Is there a second? All right, there's a motion and a second. Any discussion? Otherwise, do I do it on the screen on this one? Okay. Oh, there we go. you missing if you vote on your pad? 5, yep, I'll get him in there. 6, one more? Oh, yep, tap the screen first and then, yep. All right, and then Jimmy, are you still there? Do you want to vote? He may not be. Oh, on the consent agenda? Oh, no, he's hung up. He might be done. Okay. So we will move on, and I will actually, we're going to old business.
Can you hold on 1 second, Carolyn?
Oh, sure.
We're having a technical difficulty. Want to repush it? Okay, we need to push the vote back through, please.
Okay, so we will revote on the consent agenda. Much quicker this time. All right, so again, it passes again.
Okay, thank you.
Thanks. We're moving on to the old business, but if anyone wants, I would entertain if anyone wants to switch the new business and old business. I don't know if anyone wants to get that over with. I'm just thinking maybe. Do I have a motion to switch those?
Why don't we do, I make a motion to do the new business ahead of the old business for tonight's meeting.
Thank you. Is there a second? Okay, motion is second. Any discussion? Otherwise, all of those in favor, just say aye. Aye. Is that okay? I did it on voice vote? Okay. All right, so we will go to item 8, and then we'll come back up to 7. So item 8, under new business, there is 8A, which is I will entertain a motion to have a proclamation or make the proclamation that May is Mental Health Awareness Month, and I will go to Amy.
I would like to make a motion to read the proclamation recognizing May as Mental Health Awareness Month in McHenry County.
Are you going to read the whole thing? Yeah, can you just read
I don't.
yeah.
Oh, okay.
Yep.
All right. I didn't know if I needed
Sorry,
a
it's
second.
a new thing, yeah.
No. All right. Then I will just go ahead and read.
I'm sorry. It's Jimmy. I pushed the wrong button. I agree with you.
Oh, okay. Thank you. Welcome back. We're not.
Wrong button.
Okay.
Sorry, but I'm back.
Okay.
I'm sorry.
That's okay. Thank you. Just to let you know, we're on to new business, and we'll come back to strategic plan. So Amy's reading the proclamation right now.
All right. So this is a.
Thank you. I apologize.
No problem.
Nope. We're glad you're here, Jimmy. So the proclamation recognizing May as Mental Health Awareness Month in McHenry County. So whereas mental health is an essential part of overall well-being, impacting individuals, families, communities across McHenry County and nationally, and whereas mental health conditions are real and prevalent in our county, our state, and our nation, and whereas early intervention and access to quality care are crucial for managing mental health conditions and improving quality of life, and whereas with effective treatment, those individuals with mental health conditions can recover and lead full, productive lives, and whereas each business, school, government agency, health provider, organization, and citizen share the burden of mental health problems and has a responsibility to promote mental health wellness and support prevention and treatment efforts. Now, therefore be it proclaimed by this County Board of McHenry County, Illinois, that it hereby authorizes that the McHenry County Mental Health Board, together with the County Board of McHenry County, Illinois, hereby proclaim that the month of May is Mental Health Awareness Month in McHenry County, Illinois, as it is in the state of Illinois and in our great nation. And be it further proclaimed that the County Clerk is hereby authorized to distribute a certified copy of this proclamation to the County Administrator of the McHenry County Mental Health Board, and that it be spread upon the records of the McHenry County Board, dated in Woodstock, Illinois, on the 21st day of April 2026. So thank you for letting me read that into the record.
No, thank you. Do we need a motion and a second on it, or is it just, okay, we're just reading the proclamation. So thank you. Thank you for bringing that, and thank you for the county board for joining us in that proclamation. So the next item on the agenda is 8B, the grant resolution. So if I could get a motion on the grant, the capital project funding grant resolution. Is there a motion?
Grant resolution 8B 206 0441
there a second?
I second.
Okay, thanks. And I just will, for discussion's sake, say this is just, it came back that we just needed an official motion to move ahead with seeking out grants. So this is just acknowledging the fact that we direct staff to seek out grants, in particular on this one for the bathroom renovations, the lighting project, resurfacing of the parking lot, and roof repair and replacement. So nothing we haven't discussed, but just formalizing it within a motion. If there's any other questions or discussion? Okay, if not, then if we could do a vote. Vote on your keypads. And Jimmy, would you like to vote?
Yeah,
Okay, great.
yeah.
Okay, thank you. So that passes. All right, so now we can move on to what we're all here for. The old business discussion of workshop for the strategic plan. So similar to last night, although I worked today with staff to everyone, I mean, I know they were even working beyond the morning I spent here, but everyone should have access to what that looks like, the most recent plan. Sorry, I'm pulling mine up too. So what I would like to do, similar to last night, but a little different in that all the information is now filled in. So how I would like to go is through, we were able to, with last night, all the discussion that occurred. I'm sorry, it's in that same shared drive that was the previous information. If you go to that, it's just updated in that exact same drive. It's under the draft. Yeah, sorry. I'll let everybody get caught up too as to where we're at. So all the goals after, and thank you all for the input last night. I mean, it was really good, although it didn't follow it was like real free flowing, but we were able to take all the information that I had heard and took notes of, as well as staff had heard and took notes of, and incorporated into one of the goals that is there, if not multiple goals, because I also felt like some needed to be reiterated. So if we go through each goal, and I'll take a pause and everyone can read that goal, and then if we can just discuss the goal, all inclusive of objective items and action items, and see if anybody has input on them. Rather than just going each by each, I think it might just, I want to make sure we get through the whole thing. So I guess we'll start with that and then see where it goes. So goal 1. If everyone wants to look through that, and for those that are here, I'll just give you a little bit of background while everyone's reading through it. Yesterday, we started our strategic plan. We developed 4 goals that we're going to focus on, and then under that, objectives that align with those goals and the action steps that we would take in order to accomplish those objectives in that goal. So we have filled in all the information now, and we will discuss if that's kind of how we want to move forward, if anyone has anything to include or eliminate. And staff also worked on providing a definition within there too. So the first goal, I'll read out the goal and the definition and as people are reading through the objectives and action items. So goal 1 is collaboration, advocacy, and awareness, working collaboratively with partners, influencing key audiences and decision makers through advocacy, and expanding visibility to ensure the organization's work, impact, and priorities are widely recognized and supported. So as anyone has any thoughts, feel free to click it. And I don't know if, Bridget, you want to add anything while people are looking? Or Melanie or Amanda? Okay, cool. Or if we missed anything under goal 1, or if you see anything that doesn't make sense. Amy.
Oh, I just wanted to say thank you for collating this. I've only read through goal 1, but it looks holistic based on the notes that I took in my memory of last night. Thank you for taking all of that and parsing it into what looks like can become actionable outcomes that we can measure progress against, and I don't have anything to add. So thank you for all of the work, everyone on that.
And then just to let you know, so how it will look too, this will be our part, will be the objective and action steps. And then staff will, I mean, we can kind of guide if there's specific ones. We've already had some discussion on what that timeline would look in that 3-year period. But then they'll guide, and I think I said it yesterday, based on, staffing, the budget, what will fall into each of those 3 years. If it will be 1 year, if it will take 3 years, if it will fall in between. So I think it's good that they really drive the input on that. But there would be a whole nother section that would be added onto that would show that timeline. So,
And am I missing why some of it's colored?
oh, the colored ones had to do with the surveys those were direct results of the surveys that we received. They addressed very specific trends that appeared in those surveys. So we wanted to make sure we captured all the survey comments that appeared over and over. So for the audience sake, for you guys who can't see, I'll read through the objectives while they finish, and then hopefully by the time I'm done doing that. So objective 1 under collaboration, advocacy, and awareness is encouraging partnerships in collaboration, funded agencies, outside organizations, etc. Objective 2 is increasing various social supports through collaboration. Objective 3 is awareness. Objective 4 is identify opportunities for new partnerships and collaborations. And objective 5 is advocacy to promote structures and resources within the community that people need. And then there are action items under each of those of how we can accomplish those. So any other comments? Give me a nod when you're ready to move on to goal 2. Chris, got some comments? All right.
So yeah, I think this looks like a lot of work was done between yesterday's meeting and today. So thank you for all of the effort that went into this. I appreciate it. And I also really appreciate the efforts to make use of the survey data. As we move toward finalizing that, I, spent some time with the survey data just like we all did, and think that probably we can do a little more to analyze the open-ended questions on the surveys that we collected, because right now we just have like a lot of comments and they're not really, aggregated in any way that might help us to even strengthen the alignment between the surveys and our planning. Beyond that, I'm still, I think, maybe struggling with objective 2 and goal 1 a little bit, because it says, increasing various social supports, and I still find it a little non-specific. And then under action steps, we have more support groups, which we talked about, how many support groups are out there already. We don't know. Do we need more support groups? That's worth looking into. And then we have community-wide trainings. That shows up in other places also, throughout the plan. And then there's respite, which is a very specific issue. So I don't know if we want to flesh this out further in terms of objective 2 about what we actually mean by this, or is it something that doesn't emerge with enough clarity that we want to commit to it right now?
No, I think maybe if we have the opportunity, I'd like to flesh it out. If you have some suggestions or thoughts, or if anyone wants to speak further on kind of the intent of that objective, or what you're struggling with, maybe, Chris, as far as the...
I think it'll be hard to know if we've achieved it or not, right?
I think through action steps maybe is the whole idea of achieving, yeah. Yeah. Lynn, do you have some thoughts on that one?
Right. I think that we'll have more discussion. I think it is general right now, but I was looking at some different things. And for example, the IDD one of the things that I think is maybe not met enough as a community across the county is some social outlets. So like that's a support group, but it's not like a 12-step group or a grief group or some of the other groups we currently have. So I think that that's something that would be like more support groups, that we could look at where there are gaps. But I don't know if we want to flesh that all out specifically in here or not.
Yeah. Well, and then that's our providers, right? So our role is probably to get and use data to identify where the needs exist, which goes back to the needs assessment, which isn't clearly represented within here yet. But that's like, is it a need? How many people have the need? Would they actually go? Where and when? Under what circumstances would they go? What ages? What community? What population? And then we work with the providers to say, hey, we've identified a need. Do you see this is within, your purview? And are you able to provide this? How do we work with you to ensure you're able to provide it? So in terms of us, being more clear about what is it that we're trying to achieve and how we're going to do that. But I don't know if that, to me, that falls more under needs assessment than it does under like creative support groups. So I don't know though. Maybe it's the closing the loop on the needs assessment, saying we've identified a need, now what do we do?
And I think this is kind of the interim step to that, because specifically in the surveys, there were very specific supports systems that people were looking for. I mean, there was like family caregivers, there were, I'm sorry, there were, and we kind of outlined them there. So they were looking very specific, and I think what we can do is look at the existing network, not necessarily like in and out of our direct network, and what supports already do exist, and collaborate with those and connecting those people to those supports. I think this is so it's kind of an interim step of like what already exists, how can we connect people for the information and the support they're already seeking right now to meet with those groups. And then there were like families of those struggling with mental health, substance abuse, like those were both showed up numerous times within there. And a lot of those support systems already exist, but obviously since they showed up in our survey, people aren't finding them. So how do we connect people to those that already exist is what I believe the intent of this one is. And I don't know if you guys kind of agree with that. And then the community, right, exactly. So it kind of ties into the awareness, but awareness on kind of what we're doing versus this is collaboration and bringing awareness to what others are doing as well. So that's where we can collaborate with people and bring awareness to what the work that they're doing through our avenues. So they kind of do go together. So this is kind of like finding out how we can collaborate, what we need to then bring awareness to, and then the next step is the awareness and the objective, and now getting that out to people of what support groups are available based on information we've been hearing there's a need for.
So let's say that.
Oh. So I don't know if it's more like making connections. I don't know if you want to versus. You can maybe just flag it, and if there's a better term that comes as we move along in the process, we can see if there's one that fits better, it's more precise.
So, I mean, I think it might be more refining. I mean, the objective's a little broad, but then refining the action steps, what I think I've heard is identify what specific needs have been expressed by consumers for social support, identify the support sources that already exist, collaborate with providers where needed to create additional supports, and collaborate with providers to share information with our, constituents around the availability of services and how to access them.
So it's maybe rewording that more support groups and just identifying support systems that exist, and then community-wide trainings of like how to access them, as well as making the connections to those that may have support groups.
I guess.
Did you get that? Okay, cool. All right, and okay, cool.
I liked what you said. It is more specific. Thank you.
Yeah, no, it is, and it follows more of a distinct path. Are you good with that? If they wordsmith it and work on it? Okay, cool. Any other comments on goal 1? All right, otherwise, let's move on to goal 2, and we can do one flush at the end too if people have comments that come to them at the end. So everybody kind of read through goal 2. I'll read what it says for the people that are here. So goal 2 is accountability and quality. Strengthen accountability and quality by ensuring consistent use of provider-driven data supported by ongoing training and up-to-date standards of care. Improve how outcomes are defined and measured to better reflect service impact while using data to drive timely, fair, and informed decision-making. So under there, I think objective 1 got deleted somehow. Just the words, objective 1. But objective 1 is evidence-based practices, promote use and provide training. Objective 2 is redefine current outcomes measurements. Objective 3 is useful data. Objective 4 is reevaluate the audit process to ensure that it is aligned with outcomes and decision-making. And then we just had 4 objectives under that one. We felt like that one was more like very internal, but open to thoughts. Chris.
Thank you. Don't want to monopolize. I'm
No,
really
please.
interested in this goal. I think in terms of objective 1 around evidence-based practices, this is some of what we already do to help providers become competent in things like, acceptance and commitment therapy, EMDR, DBT, that's some of it, but it's also helping them to become competent in evidence-based assessment of their program outcomes. And I think it's within our purview to provide training support to our network partners on how to utilize tools to evaluate outcomes of their programs, and I volunteer to run that training if you want. And then aside from that, the other piece that I think we've talked about that isn't clearly represented within this goal is working to create a needs assessment utilizing existing sources of data, determining what sources of data are not yet available and compiling it so we can share it amongst ourselves and with other interested constituents to guide our observations about what systematically are the greatest needs in the community that are unmet. Are there any redundancies, and how do we kind of direct our focus towards addressing, substantial unmet need?
And we do just, we did actually make community needs assessment a specific objective later on into the goals. It's not an independent goal, but we made it an independent objective under did we do it on a community? Under goal 4. Because, we also talked about, we could put it into an action item if we wanted to, but we felt it was such a substantial action item that it really needed to be an objective within a goal. So, open to thoughts. That's kind of where we ended up at in the discussions. Because it was originally under just an action item, but I felt like it was such a big undertaking that it really needed to be an objective. And then you can, in the action items, what are you going to do to accomplish that, and include all the information like you just said. So, but we could also put it in an action item of another objective. No, I know. It was originally, but it was under action item under this goal, and it just seemed like it should really be an objective, which is kind of why we talked that out, but open to other thoughts. Otherwise, Linda.
Okay, I think under action steps, excuse me, increase trainings by a certain number of trainings per year, that is not specific enough. I'm not sure what we're talking about. Are we talking about providers providing training to the community, or are we talking about us providing in services to providers? I'd like to just clarify that in the document. Okay. And then setting expectations, the 4th action step for non-human services, but then you include administrative support and AI operators who are indeed human. So we need to just word that a little bit
differently.
differently.
Meaning, and I get you meant administrative support, that's AI. is what you're meaning.
Yeah, but non-human sort of is where we were going.
Well, non-human, no,
I
this was, incorporating that AI that Amy was talking about yesterday. This is kind of where that got put into. Yeah. At first, when I saw it too, I thought non-human services, but then it's specific, meaning AI.
This is provided
By non-humans. Yep,
Got
bots,
it.
AI, whatever, yeah.
Just for a matter of clarification, could someone give me an example of non-human services that are being implemented right now that this would fall under?
100%, yes.
Yeah.
On a provider's website, hi, I'm chatbot Amy. I'm so happy you're here. What can I help you with? I am looking for an autism screening. And that's it. There's no response. Or, I would like to schedule an appointment. How do I do that? I'm sorry, I can't help you with that. Like, that is a terrible,
All right, so this is
terrible
something
interaction.
that exists in
Today.
the people
Yes.
that we fund.
Today, yes.
Okay, great.
So I want to make sure,
a lot.
no, yeah, I want to make sure it works with the no wrong door policy, that you receive a response and somebody's monitoring it. Yep, yep.
Yeah, and if there's other suggestions on where to better incorporate it, we definitely want, I mean, that's a great suggestion that Amy had yesterday, and it definitely needs to be incorporated somewhere, so this is kind of where it landed, but open to other thoughts or suggestions on it.
Sorry, I just want to clarify further. You say admin in here, which is absolutely perfect in what I'm talking about, just to be super, super clear, not at all referring to it replacing more professional services like therapy or something, like really was purely focused on the admin. I think the goal is clear. I just wanted to state that that was my intention, just for like super clarity.
So that
Yeah.
includes things like voicemail systems that go on and don't really get to it.
I mean, I hadn't thought about that, but I think that that is worthwhile, honestly. Yeah. Just making sure that if you have that sort of administrative outreach, AI being the new component, I think it is right that we have a point of view on it and an expectation that it will not decrease somebody's experience within our network.
And maybe in that, you just say, instead of like admin support, because maybe it's going the wrong way, just put including technology, AI operators, like using technology instead of that, and kind of specifically, how is technology used? It kind of opens it up then, talking about how do we want, how are we going to allow to support those that utilize technology? And I mean, we've already had that kind of even with just social media, or like, virtual trainings, or, how do we want that to actually look? It allows that by including technology maybe in there and AI operators, just kind of. Oh, Tom.
Sure, the non-human services, do we know of any of providers that are currently utilizing this? So we do.
It's, I don't want to, one-on-one, I'm happy to give you specific names, but chatbots exist on not just our providers, but a lot of webs. Like, it's a very
Yes.
common and efficient, and I'm not against them existing. I want to make sure that they are.
I've dealt with them. I've utilized them. I don't like them, and I do everything I can to get around them.
But they are inexpensive,
Right, so that you don't have someone up at 2 a.m. that wants to deal with this. But yeah, I could see in limited circumstances how they could be helpful, but at this point, I don't think technology is caught up where we could feel confident that it's a fail-safe item. And I like where you're going with that.
But to answer, yes.
So we're looking for a unified statement from the board that can help guide our providers in which direction to go with it, rather than just kind of.
Right,
Yeah.
right, because, sorry.
with the thought of this being a 3-year plan and AI, I don't think we can even say it's still in its infancy, but it is slowly rolling out. Like, I think if we don't come out with at least a point of view and some guidance now, we're really missing the opportunity. And we can always refine it, in the next plan. But I think, honestly, my biggest concern, and there might be more, is all the work that is done for No Wrong Door and the handoff and the referral, and making sure that if somebody is brave enough to reach out, that we intake that information in a thoughtful way and do something with it. And I think that's an expectation that we can set, is that if you are using AI or some kind of chat bot, that you are treating it the same way as a voicemail system. Yep.
Yeah, there's a lot of work that can go into that and setting into something. So good.
Great. Okay, any other on goal 2? Do you feel like it needs anything more? There's, and we don't need to have 5 objectives. We were shooting between 3 and 5, so this one has 4. But if there's another one that anyone feels needs to be added, we can. Are we good to move on to goal 3? All right, so we're moving on to goal number 3, access and coordination. Improve access to and coordination of services by reducing barriers, strengthening community partnerships, and expanding service delivery options. So under that, our objective 1 is expansion of services to underserved areas. Objective 2, promote and increase access to youth services available in the county. Objective 3 is affordability of services. Objective 4, promote and increase access to services available in the county to counter social isolation in all age groups. And that one we also had 4 objectives. We did not have a 5th, so it's open for discussion as well. So as you go through, feel free to jump in. Amy.
This might be a little too broad. I love that under Objective 2, we worked in explore and put into place methods to evaluate and measure the effectiveness of prevention programs, because as we discussed, we're sort of lacking there right now. Is there, this might just be too broad, I apologize, but is there some connection between Objective 4 under access and coordination, so services in the county to counter social isolation in all age groups? Like, to me, I feel like there is some connection between trying to address social isolation feeding into prevention services. And I wonder if we just want to note that we will explore the relationship between those, like perhaps a success metric of Objective 4 might be that we now have one measure of prevention effectiveness, or vice versa. Like, if we see prevention being measured effectively, then we're seeing less social isolation. To me, it feels like there is some connection there and that we should call it out. But as you can see with my struggling to explain it, I don't know exactly how.
And we struggled, I think, just in the prevention piece in general on trying to measure it, and not just in social isolation, but in like prevention as a whole. So we had that discussion, open to any other thoughts on how to best connect those, or we can even add that, we can add an action step if you feel like we can duplicate action steps. They can cross over too, if you feel like it's appropriate for them to cross at times, We struggled. I mean, prevention is definitely one we had a good amount of discussion. It's one we want to include. We feel like we even want to invest more in, because you can get like that exponential. I mean, it's definitely cheaper, less expensive to invest in prevention than it is into treatment once you hit a certain level. So like really getting that prevention and being able to prevent it from escalating is really what we were hoping to focus on. Well, I mean, both, but there is no measure. Like, that's the hard thing is like, how do we measure that? Chris maybe has the solution for us.
There is no solution. So it's not just us. Like everybody that tries to assess the impact of prevention programs struggles because it's very, very hard to measure something that did not happen because you took action. So it's a more indirect way of measuring things. We know that the loneliness epidemic contributes to exacerbate symptoms of mental illness and the risk of substance use. So addressing the loneliness epidemic by working collaboratively with our partners and with the rest of the community and the support groups, it feeds back into Goal 1 also. So there's a lot of interconnections throughout the goals. And we track, we gather data from people about, hey, we've, tried to create more social connection among people in our community. Has it helped? And we track, how are we doing with regard to, rise in people seeking services for mental health concerns and substance use concerns. And if we find more people saying that they feel connected within the community and fewer people saying that they've experienced symptoms of mental health concerns and substance use concerns, we draw a connection. Are we able to say, hey, we prevented that from happening? Probably not.
Is there something, open to, Linda, you have something that I will throw it out there. If you feel like there's a way to make that connection that would, be able to be measurable, or at least kind of lead to that?
I think, I'm just going to sort of, ramble my thoughts out here and see if it strikes anybody, but I think Alex mentioned when he did his public comment to us about how many people they have seen. And we've also got on our goal list here how many support groups we have in finding gaps. And so I think we can look at those two things is number of people reached in we have numbers on how many people our providers are seeing with identified substance use or mental health problems, but how many people are coming to support groups and other things that are not necessarily directly related to a problem, and we could call that as prevention, and also decreasing social isolation because they're meeting with a purpose. And so I would like to see some kind of verbiage in here. The only other place where I can think that you could mention it is when we do our community needs assessment, there are questions in there about how, how emotionally isolated do you feel? Do you feel like, there's places you could go if you needed help? There are questions like that in the community survey. That's 3 years away. It's infrequent, but it is a measurement. I don't know if it's valid or not because it's a little loose, but.
John?
And I don't know if this helps, Amy, but in Objective 1, where it says expansion of services, maybe if we put in there something like to foster the expansion of services, and under the action steps, where it says identify partners, maybe invite partners, and to follow up with to assist those that suffer from, right? So maybe we could somehow invite them to say, look, do you have, some of the people that you're working with, or do you know of people that are suffering from, right, through an invitation to, foster that help? Because it just says, and I get it, one, it's expansion of services. Well, maybe to foster the expansion of services or to, invite the partners instead of identifying them. Because if we were to invite them, maybe they'll insert themselves, after they know we see a challenge there.
I like those suggestions. Yeah, I think that, foster expansion is a really good way of putting it because it leaves it to multiple options of doing it too. And then, I agree. Yeah, I like that. Did you guys get that? All right, cool.
I had a problem with that yesterday too. It's like, what are we going to do? right?
Yeah, no, I like it. I like it, I like it. Any others on goal 3? Or any additions? Or Amy, did you have any more thoughts on that? I mean, you don't have to, it doesn't have to end here. You know what I mean? If a thought pops to you after this isn't like final set in stone right now. We can still, if you think of, oh my gosh, that's how we should have said it, we can still do those kind of things. Okay, no. Or any other objectives that you want to add to that one? Otherwise, we can go on to goal 4. So goal 4 is community resource development. Develop, expand, and sustain accessible, coordinated community resources that address identified gaps, strengthen workforce capacity, and enhance collaboration with partner organizations to improve access to community resources. So in objective 1 is identify service gaps through a community needs assessment. 2 is support workforce wellness and development. Objective 3 is coordination of services with partner organizations regarding transportation, housing, food insecurity, and et cetera there. And objective 4 is develop, promote, and provide a community-based training program to provide education on mental health, substance use, and IDD. And objective 5 is update and rebrand the McHelp app. And kind of our thought on both of those were that's where we put the needs assessment and the McHelp app, because we felt like those were 2 really big undertakings that we needed to put a lot of work into, and there was a lot that could go into each of those. So I think they were first action steps, but it became objectives through our discussions. So we'll open it up. Or feel free to read and we'll. And Bridget, Melanie, or Amanda, feel free to jump in if you guys had any additional thoughts from discussions too. Oh, I'm sorry, Linda, thank you.
That's okay.
Go ahead.
I don't know if objective would be better written as identify service gaps and that's it. And then one of the action steps would be community needs assessment. And I like that you have agency input because we have and do utilize the meetings where everybody talks together from all the agencies. And so that helps us determine gaps as well. So I don't know if the whole community needs assessment is more of an action step than it is an objective. But either way, I think that that's good.
And that was, the kind of struggle that we had of, it is sort of an action step, but it's such a big undertaking that we felt like it really needed to be not minimized by the action step, but rather put into an objective and what we wanted to accomplish within that needs assessment, put into the action items. So that was kind of our, but if others feel it should be, Amy.
I have a, under the second, I don't have any comments on the first. I'm fine with the first objective either way, either leaving it with communities or not. Moving on, not moving on, but objective 2, leadership training available to agencies would refer to staff within the agencies being able to receive leadership training. All for that. So that I have a couple of thoughts. To me, that feels, I think that is valuable and I think that is warranted. And I think that to some extent that falls under the general umbrella of community resource development because we're developing people that provide to our community as opposed to directly like the end users, if that makes sense. Do we want to incorporate in here an examination of, because this came up in one of the surveys as well, of wages?
I know it was an action item, or not an action, but it was called out in one of the many surveys that we just kind of accept that people have to not get paid in order to be in the field that all these providers are in. I'm not saying just volunteer, but that the rates are extremely low. Do we, since we've talked about, like Bridget's giving me, so maybe not, but like examine what resources we have to affect that? Is that just a big can of worms? I mean, if we're going to have something about staff at agencies under this one, that is a part of wellness and development and impacts our ability to serve the community. So do we just want to have a soft, like, just see what we can do over the next 3 years as opposed to setting a goal? I'm just putting that out there. I'm seeing all the reactions and I feel like I've set off.
No, and I'll just say because we're a member of ACMI, like I feel like they do a very good job of that. Well, and I see it at the state level, like how organized the groups on a state level are. And they are, constantly, I look at it like, can we control that? Or what can we do as a mental health board to really affect the wages? And I mean, even if we could affect them, we could maybe at best affect them in McHenry County. But these are, a lot of the positions too cross counties or it is a state problem. And I mean, I was reading a letter today about, increased wages for caregivers, increased wages for, I mean, it is every year around this time with the state budget, there is advocacy centered around that. And I think by us being part of ACMI, that covers it, because people within the community, I would love if we could have an impact on those wages, but I don't know if I see I don't know what we could do locally or here within the county that could affect it on that grand of a scale, besides participate in those advocacy groups that do advocate to the state that kind of sets those wages. If anyone has any thoughts or suggestions, Chris?
Yeah, I mean, I think under Objective 2 with workforce, Thomas had great ideas about internships, and I talked about paid internships, and the other problem is what you brought up, which is also what I was thinking about, so there have been bills changing the rate of reimbursement of people working in the DD system, and then there are other cutbacks within the DD system to counteract the impact of the increased cost of wages. And this goes back to advocacy. So advocacy is under Goal 1, but then within Goal 4, Objective 3. We're coordinating with services and having a table in the development of programs and seeking out partnerships and this. So it says we're regarding, transportation, housing, and food insecurity. So this is kind of an advocacy goal. And, what we're talking about is continued advocacy. It's like, I don't want to just depend on ACMI to do this work for us. We represent ourselves and to an extent the community, and we know that part of the reason why we can't attract enough people to the community to serve the needs of people within the community is that these services don't pay enough. So is it a state problem? Yes. Does that mean we have to just sort of step back and say somebody else is going to solve it? No. We have to also gather information that demonstrates that this is the problem. This is the extent of the problem. This is what causes the problem. This is what has to happen to solve the problem. And then pitch in with others to, work with our legislators and work with advocacy organizations to try to figure out if we can make incremental change to try to solve that.
Do you have any suggestions on that? I mean, do you have any specific action items? I mean, I know advocacy, so we could do that, if legislation becomes available, that we, on behalf, make resolutions. I mean, we have that ability to make a resolution, put it to the state if we want to advocate in that sense. I mean, that's, Amy, if you have any other thoughts on it.
Oh, no, it's a minor add-on. I was thinking just making a resolution or saying something like that, or as awareness, and yes, it is incumbent on all of us individually to make ourselves aware as well, but, if there is witness slips that we could submit because something is coming up to vote, bringing awareness to that so that we could choose to lend our name to that. I think we are a fairly large board in the state, and even though I know it sometimes feels like words are hollow, I think they still matter, and I appreciate the call out about Akamai. Absolutely, I don't want to reinvent the wheel or spread ourselves too thin, but since other things were incumbent in here, I felt like, is it worth calling that out separately as well?
Yeah, and I have no problem, adding under that, support,
Like a prevailing wage, people that we serve, or to the agencies that we give money to?
Continued advocacy and support for a prevailing wage, improve.
I don't even think it's that. I think it's even the reimbursement rates or, support an increase in the wage, or maybe we could word that such. I don't mind doing that. If we're going to do that, I want it to be specific because I don't mind, on behalf of the Mental Health Board, putting in a witness slip or putting a letter to our legislators. I don't mind doing that, bringing it through this board. If we want to make that an action item, we can do it if it's specific to wages or, support legislation specific to increasing wages for IDD caregivers or whatever we might want to make it. I don't have a problem doing that. Tom?
I notice we have a lot of associations with outside networks, other advocacy groups out there, and I'm probably certain that some of them have lobbyists that are down there in Springfield trying to advocate for what we're trying to do here as a board. I think what we're trying to get to is work with other agencies and advocating for workforce development and the areas that we're looking at.
Yeah, and that's the one that we're part of. That's what they do, is they lobby down there on behalf of the mental health groups. There's others too, yeah, but.
They're partner with other groups that are advocating in Springfield increase prevailing wages, not just wages, but, workforce development and mental health services, substance use disorder, IDD.
Yeah,
I think there's already systems and processes in place that we just have to partner and strengthen with, which would go back to one of our other goals of collaboration, advocacy.
I can't really, I don't know, Bridget, if you can think in the process there. The only thing I can think of is, there are other lobbying groups. There are ones that lobby on behalf of organizations that we're part of. The only other, I don't think we're going to join any more because it's very expensive to do that, but we can put in support if we want resolutions to come through here. We can discuss what those resolutions would look like, and then we can put our formal support into legislation.
Well, I've been down in Springfield. I've talked to some of my Congress people about different issues that were important to me, and it's a quagmire of, if you go down there by yourself, you can easily get overwhelmed. And I think when you have a lobbyist that's working on your behalf, if they know the areas that are important to their members that they're down there in Springfield, they work really well with a lot of the congressmen and getting certain bills attention.
Yeah, and we do have some already. I work for Senator, so the process is such that I just don't know what more we could be doing besides just contacting our local legislators or putting that. I have no problem adding that as an action item. I have no problem doing that. And then, with staff knowing if we want to make it specific to workforce, if we want to make it specific to workforce within these 3 pillars, I have no problem that if there's a bill, we know when those bills are, or we know what they are. If we want to put in witness slip, we want to send that letter to our legislators and we want to vote on it on behalf of the board, I have no problem having those conversations. So I think that would be the most effective way of doing it. And Bridget, you can weigh in too because you've worked there too, so.
I don't know if there's any other suggestions besides what you're stating. The only other suggestions that you've made in the past is possibly having a legislative committee within your within your board, but now that you're at the committee of the whole, I don't know how useful that would be, so that you're discussing specific bills. I don't know how useful that would be, so.
No, I think if we put it specific, an action item specific to increase in wages, and I forget, there's two different, I think there's caregivers, that's always in the budget, and IDD.
Yeah.
Those two I can think of are always in the budget
Always,
discussed,
always.
yeah.
Yeah.
So those specific ones I can see, including if we wanted to, I can't think of other related to workforce besides those two that are always coming up every year.
Correct. Those two. Well, yeah, housing always, but
What was that?
housing. but
Oh, yeah, but I'm just thinking,
Permanent
yeah.
supportive, yeah.
Well, that would open a whole other can of worms these days. Tom, did you have any more on that one?
No, I'm just trying to understand, how much do we want to invest in this? I mean, witness slips are great,
Well, that's why if we vote on it, we can actually have one coming directly from the Mental Health Board. And you can also actually have then that resolution shared with your local legislators, which to me, that's the most effective way of something we really can do.
Well, bills come up so fast, they get changed, they go to committees.
No, but that one comes with the budget. Like that one comes every year with the budget. So that actually only gets incorporated into the budget every year. So even though it comes up as a bill and people start advocating really early, actually now around this time when the budget's getting finalized, that's when that's when that advocacy really even comes more important.
Is there a group that goes down there like Action Day on the Hill or something?
I will say there was when we were actually there. We could participate in that. Maybe we do that. Participate in advocacy days. We could make that a goal too.
Because if you've ever been down there, there's people that got shirts on, they're standing outside the chamber doors.
When we were there, yeah, actually it was Independence Health that actually. John and Lori were walking to the Capitol with me, so we could go on those days. They had the IDD community was there that day. There was supportive housing was there that day. I mean, if we want to do an advocacy day, that's a good action item. There.
I'd go down to Springfield.
We can incorporate that as an action item. Do we want to put that under the workforce though? Something that's specific to workforce and those wages, and find the appropriate advocacy day to do? All good? Okay. Linda.
Two things. One is advocacy and witness slips are a good idea. I'm very frustrated. They don't hardly ever go my way when I file one. But, you still have to have your voice be heard. So I would say that not only from this board, but we do have the access to share with our providers that there is a bill up about X, whatever the issue is, if they want to express an opinion and how to do it. That would be an action item. I'm not saying we should do it. I'm throwing it out there. The other thing is the midterms are coming up, so making a statement. For example, May is Mental Health Month, and we want to let you know as a candidate for the governor or for the Senate or for whatever, that we have some concerns. We have an excellent system here in McHenry County, but where we meet blockages are, and we can put some of our issues to potential candidates. And I think they're more willing to listen and respond to those before the election than they are after.
And I will follow up on that.
Well, we need to, yeah.
Yeah, I like your idea about informing people. I think what we can do, though, is inform sitting legislators, although you may disagree that they listen more than candidates do. But we cannot get involved in any sort of campaign. No. I know, and I know you're saying educate, I know. And so I do think, though, where the line is typically drawn as a sitting legislator versus a potential legislator. So we do need to kind of draw that line. We have said, I mean, we can have a legislative day where we invite our legislators in and educate them. We can send those letters out to the sitting legislators, but anything prior to that, yeah,
We
it's
need to
just like,
stay
you as an
absolutely completely
individual.
nonpartisan.
Yeah, but yeah, to keep it like, nonpartisan, and even when they're sitting, it's nonpartisan, because that's their state duty, is to represent all. So just, we're very close to the process, and so that's the line we kind of need to draw, is like, once they're elected and in office, we can have those conversations, we can invite them here, they can, have, if they wanted to, come, and we've had them to the, had them to the network council. If they want to come in and sit in on it, they want to come to our meeting, great. If a candidate wants to sit in the public, great. But like, as far as us reaching out and engaging, it really has to be a sitting legislator to do that. Chris.
Yeah, I appreciate you. I appreciate the conversation. Regardless of like exactly what action steps it turns into, I think it's an important kind of like thought experiment, and I think it's really worth us taking our time to explore, what we can do, because it is a big problem. My son earns more at Amazon than people do providing care for some of the most vulnerable people that exist, and it creates difficulty for the employees, it creates difficulty for their administration, it creates difficulty for the consumers, their families, and whatever we can do, I think is great. I appreciate you making it clear about what's our role, let's be realistic and feasible, let's be concrete in our, what we articulate as an action step. I think that's important, because I could certainly get unrealistic and not be able to create a clearly articulated action step that we'll know when we've completed it or not. So, I appreciate the conversation. It's worth having. Other thoughts that occur to me, like things that we can do, like we can track how bad the problem is. We can work with our networked agencies and say, how many staff have you lost? Because you can't pay them. What do they need? What would you need to pay them to keep them? Like, how much are you spending to hire new people and train them over and over, and sometimes, have staff who are not successful in this discipline because you're not able to attract someone that you'd be able to attract at a higher wage. Like, I think we can maybe get and use information that we can share with our legislators. Can they, create file support bills? We can work with our lobbyists, and I think that was a really good point about there are lots of other lobbyists out there. I think the ARC has a lobbyist, NASW has a lobbyist. Are they communicating with each other? I don't know. Do they know we have this problem? I haven't talked to them about it. So, the idea of like tying threads together across the various entities that are trying to engage with Springfield, so they all know, hey, we think this is a problem. Whatever you can do to help is welcome. We can track whatever lawsuits are out there. And the word amicus brief came across my mind. I don't know if that's probably outside our purview, but I think us as a hub for communication, you talked about us a hub yesterday, so us bringing information in from our agencies and sharing it out to these entities that are trying to do good work in this space may be what we can do.
Yeah, and I'm fine with doing, I think it's really specific. Like, I think it sounds like we're kind of gearing it towards the wages. And this, oh, it is, absolutely. It's a huge issue, and it honestly comes up every single year because they don't address it. And so I would like it to just be very specific, and then I think it's doable. I just think it, and advocacy is that's great. Like, I think it's specific, if we go down there on an advocacy day too, maybe we make those connections, or maybe we share those ideas. I don't know how we want, with this workforce one, it's kind of getting into two different parts, because I know in the surveys, it was like workforce pertaining to people being able to get trained and have access to jobs. And now we're, and now the other side is people that are working with our providers. It's a completely different type of workforce that we're talking about. So how we can, lump both of those under the same objective, I think is, but yeah, if we're addressing both of those. So I think maybe sticking with advocacy or advocate for higher wages for, I know that IDD in particular is a really really big ones. So if we want to do that, and that can look like many different forms. It could be supporting it, it could be going down there, it could be whatever it might be. But Amy.
Oh, super, thank you. I realized that I threw something out that probably extended the meeting a lot, and sounds like it was fairly big, and I know it was last minute, so I just wanted to thank you for the discussion and all the ideas, and that was all.
No, it was great. I mean, it's definitely an issue. John.
And I don't know, am I just, spending more time on this issue, but I know like on the senior services and the grant commissions, and when we would look at, from the county level, when we were giving money to transportation, the rides, and, they would say, well, and our budget is all gas volunteers, none of it goes to the staff, all of this money goes to help the public. And you think of the optics, a body that's spending all tax dollars to say, hey, are we making enough money? I can also see, I used to help Little City of Palatine. They never paid their people enough, and they did have turnover, but they also had a lot of people that were dedicated to what they did and stayed for my brother-in-law's and my family. My brother-in-law retired from there 40 years and raised a family. So I just don't know, but I worry a little bit about the optics. If we were to say, okay, well, we're going to give you money, but how much you pay your people? Do you pay your people enough, or should just the optics. And I'm not saying it's not a problem, but I'm personally challenged, wondering, again, is this our lane to just say, how much you pay your people? I don't.
Well, the state sets it.
I don't know where we're going with it.
I mean, and the state sets that. So that is like the state sets it.
Right. So how much can we do from this body to?
It is tough, because I don't want to spend more taxpayer dollar and be like, well, people are getting rich because someone's going to think that, right?
Right, the optics of it.
Right, the optics of it. And then it takes a little bit longer to explain, well, XYZ provider has gone through 16 people, or there's this fee for service or purchase a position usually that we're not able to fill, so then our fund balance grows, and now we've got 500,000 more to, it is a huge
An example, why
interrelated.
is the Catholic Charities delivering all the food now?
Right.
Right?
Right.
Because they can't find anybody else to do it.
Right. So I think that it's one of the more difficult things that we need to do to navigate that. We are trying to do the best for everyone, and I think you have a very valid point, is that we're trying to be very respectful of the dollars we're charged with, while making sure that part of being able to provide care to our community is that we will carefully evaluate items that we want to advocate for at a level that is way beyond us at a state level, and make thoughtful decisions in that regard in order to continue to make the best use of dollar. But I appreciate your point so much. You are not wrong whatsoever.
And not to say, oh, no, stop, but it's just like the optics are just so terrible.
But I think we can address that in the process. I think, as I'm thinking through this, I've always said I'm not opposed, but I just want to do it publicly. If we're going to make a statement, we need to do it publicly, and then we need to share it with everybody. So I think it's an opportunity for us to have that advocacy. If we want to do it specific in wages, I think it's fully appropriate, to make a healthy workforce, and to put forth a resolution that would include all of the challenges that they face, and really bring reality to the dollars that they make, to the work that they do, to the hours that they have, really putting in there the reality of what the individuals go through on a daily basis, and the state decides to then cut their funding, or reduce their dollars, or reduce their hours and increase their dollars, and, they end up making less because of the decisions, and they're like, oh, but we gave you a wage increase, but we took away your hours. I think having those into into a resolution are impactful. You know, I think that is something that you can provide to the county board, to your legislators, to, you know, and you can explain it. So then I think the perception goes away because you explain the reality. And so I think it's appropriate to put that as an action item into here, and it could be under advocacy, and then we can bring it forth as appropriate on what that would look like. But as long as it comes, you know, to this board and through here, and then we do to distribute it to the appropriate channels and bring that reality. I mean, it's absolutely true. This is an area that, honestly, it does. Every year, it just gets forgotten about, and it doesn't help anybody. Well, maybe a few, but not the important ones.
Yeah,
So,
hard to argue the point, but on the other hand, too, I mean, more than that, the advocacy part and the statements of doing that, I wouldn't want to spend Bridget's time and energy pushing it too much either, though, because, you know. Well, not so much making enemies, it's like I wouldn't want to ill-spend our directions either, you know.
that's why a resolution used
a
properly
resolution would be
and
to
distributed
draw some
properly
awareness.
can have an impact. So, yep,
Yeah.
it's appropriate. No, I think that's great. Great idea. I think it's good. We're good on how to include it.
Yeah, I think it would be time well spent. I think that the one thing that we should include, that this would be provider input would be necessary. Yeah, I mean, because without provider input, the trickle down of some of that stuff, we would, if we don't realize the trickle down on some of the stuff, we could cause more harm than good if we don't look into that. So that would be my one suggestion. Thanks.
Yeah, and appreciate those thoughts, because it did. I mean, I think the advocacy last year led to exactly the situation of, okay, you got, literally, they did. You got an increase, but we're taking away the number of hours that you can charge for. So overall, it was like a net zero. So you got to, you know, and then it was like, wait. But they're like, but we gave you your increase. Linda.
I just want to, I like the idea. I like everything that you're talking about. I also know that a lot of times people, as John said, are very committed to doing it because they believe in what they're doing. And so I think it's important when we're talking about developing the resources, it's nice to provide training for the people who are the professionals, but just a statement of a proclamation of appreciation for the direct caregivers goes a long way, where they don't feel just looked over. And so I think that that would be another minor but important thing to do.
Yeah, and I don't know if there's ever a month or anything for that, but there is. Perfect. We will put a proclamation on there.
And while I still have the mic, I want to, it's a different topic, but I just want to throw out there, we did bring up the problem of wait times, and I don't see, and that would be under goal 3 with access and coordination, but I don't really see where we have addressed it. And I don't know, you know, that we can fix it, but I think we need to look at it and have it be mentioned that it's identified as a problem and that's something we want to address. I mean, it could possibly go with objective 3 under this with affordability of services, you know, because we're talking about access and we want to make sure that people can not only afford it, but they also want to be able to get their needs addressed, and not and it's hard because we do IDD where we know there's going to be a wait, but we also want to make sure that we're not having people wait when there's a substance use or a mental health problem. So I'm open to wording, but I just think we need to address it.
Great. Amanda, do you want to say something?
Yeah, I can speak to that a little bit. In the second goal about accountability and quality, we talk about breaking out our outcomes by pillars of care. So a substance use outcome, a mental health outcome, and a developmental disability outcome. And I think because our wait times are so heavily influenced by those developmental disability wait times, you will not see anything close to what you're seeing. It's how we're reporting the data is what I'm saying. And so that will address that. I don't think the reality is not that people with a substance use problem are waiting 103 days. In fact, our opioid settlement funds show 0 wait time. So I think that's how skewed the data is by how we're reporting it.
Peter just talked for a second.
Even here.
I think I hovered over to ask Gemini.
Jimmy, are you still there? I forgot about him. Okay, he's not there. Okay. Okay, he hung up. Okay, I just wanted to not miss him. I was going to be like, yeah, I was just going to, I haven't asked him at all if he had anything to contribute, so I felt bad as I just remembered. Any other? Oh, Linda.
Perhaps we can mention under our advocacy then, just that we want to include that in our proclamation, is that the wait times are unreasonable, because that is also a state issue that we can't necessarily address.
And it could, maybe it could be all in, I mean, do we want to put it, I mean, that, I don't know. If we want to include advocacy somewhere, it's just up to you. I mean, you get like the PUNS list is one that, that's the state problem, and they're not getting people off there fast enough, and I mean, that leads to the wait times.
I just think it's not a good situation. I don't know what to do about it, but I don't, so maybe we don't put it on here, but it's just, it's a very sad situation that we have aging parents taking care of people without a good support or backup system. It's abuse prone, it's all sorts of bad, and just like pretending we don't see it because we can't really fix it. I don't know. I don't know what to say about it, but I think we sort of ought to
We did have it.
include it somewhere.
We did have, where did we put that? Where we put the state, we had somewhere where we were talking about like state issues, counties.
I think it's under Goal 1, Objective 5.
Yes, find opportunities for state, county, and grants to support the community needs. So if we want to reword that, include, I mean, I don't know, it says advocacy to promote structures and resources within the community that people need. So that was kind of what we were thinking of in there, is like advocating to the state, or, putting the responsibility on the state, reminding them every once in a while of their responsibilities. That's what we were gearing it towards that. Yeah, so if we want to put another action step more specific under there, we could do that too, because that is actually what we were thinking along those lines. Or make it more obvious in there. That'd be great, yeah, because that would fall under there. Excellent. Any other thoughts on any of these, any of the goals, any of the layout, any of the action items, objectives?
It's an incredible amount of work. You guys did all.
Yeah, it was. I think there's a lot we could get done, though. I think it's going to have a real good, they were all, we made them to be all realistic action items, pushing the limits of it, but being realistic at the same time. So challenging, yet, the staff did an awesome job putting all this together and flowing with this format and capturing all of everyone's ideas. I think we incorporated what we heard and what they heard, and so I think that was great. So thank you everyone for the contributions to this. Staff, do you guys want to, or Bridget, Melanie, Amanda, want to add anything? Any questions on it? Otherwise, we're good to move into draft form with this, and then it'll come in May. But if anything, like I said, if you wake up in the middle of the night thinking of the right wording or whatever, feel free to send an email first thing tomorrow morning. But yeah, you can always give them emails, and they can, redo it before that draft comes out, and then we can still talk about then too. So.
Keep it on the OneDrive so you can keep an eye on it too. So, yeah.
Great. Well, thank you. I appreciate all of that. So with that, I think we can move on from strategic plan. Are there any member comments? Oh, that was old business. That was it. The strategic plan was it. Yep, that was the old business. Yep, we went back and that was it. Yep. Yep, nope. Chris?
I just want to really encourage people to come to the mental health town hall, the mental health board town hall, if you can, like our group, as much as possible. It's really hard to run the thing when there's not enough people there. We really, really need everybody's help to make it work. It's a fair amount of work, but it's also a really, really good opportunity for everybody to kind of like, their providers, their community members. It's great for us to show up as a collective, to show, kind of our unity, our interest, our, kind of show that we're, seeking people's input and trying to use people's input. And, I really, I find it challenging, but really valuable.
Thank you. Anyone else? All right, we do have need for an executive session, so if I could get a motion to go into executive session for appointment, employment, compensation, discipline, performance, or dismissal of specific employees pursuant to 5 ILCS 120-2C1.
So moved.
Do I have a second?
I'll second the motion to go into executive session.
Thank you. Roll call.
Christina Brune?
Yes.
Adam Carson? Linda Hoke?
Yes.
Deanna Kell?
Yes.
Thomas Lang Henry?
Yes.
Amy Rath?
Yes.
John Reinert?
Yes.
Carolyn Schofield?
Yes.
James Swarthout.
He's not there, so. Okay, so we will go into executive session. Amy, can you take notes?
know you're ready, and then.
All set? Oh, yeah, we're good. You need to recall, we did not go back in yet.
Okay. Christina Brune.
Here.
Adam Carson. Linda Hoke.
Here.
Deanna Kell. Thomas Lang Henry.
Here.
Amy Rath.
Here.
John Reinert.
Here.
Carolyn Schofield.
Here.
James Swarthout.
Okay, so we're back in regular session. No decisions were made in executive session, or no votes were taken. So I will entertain a motion to adjourn.
Motion to adjourn.
Second. Okay, motion is second. All those in favor say aye. Aye. Any opposed? All right, we are adjourned. Hopefully see you all at the town hall on May 7th.